It is the popular saying that a healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nancy Oshogbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Complement of the season. It is the first episode of the Great Mind program in the year 2022. I am Bola Olayode. I celebrate the faithfulness of God over the lives of you and I for ushering us into the new year and loading the year for us with great benefits. This episode of the program centers mainly on the review of the activities of Osun Health Insurance Agency in the year 2021. Osun Health Insurance Agency has among its objectives ensuring that every resident of the state has easy access to effective, quality and affordable healthcare services, protecting families from financial hardship of huge medical bills, containing the cost of healthcare services to attain efficiency, ensuring equitable distribution of health costs across different income groups, and also maintaining high standard of healthcare delivery services within the health sectors. The enrollees of Osun Health Insurance Agency are in 4 categories: the formal sector, the informal sector, the vulnerable population, and the tertiary institution health insurance program.
The number of insurance scheme that we have is variegated into 3 sections. We have for the people in the formal sector, we call the formal sector because they are the workers of government, so they earn salary directly from government. And we have it from the informal sector. The informal sector are the artisans and the people working on their own that will be interested in actually coming into the insurance policy. These 2 categories of people have to pay premium. The premium is what we pay annually. But the other category is the vulnerables. The vulnerable is being taken care of from 2 funds. We have the equity grant by the state government, by the local government, and also the basic health care provision fund, which is being remitted for the care of the vulnerables. The vulnerables, what we mean by the vulnerables are the people, the poorest of the poor. They cannot afford, you see, even food, not to talk of basic health care for themselves.
Since Osun Health Insurance Agency is committed.
The truth is that when you have a woman that is pregnant and the woman is going to deliver, he gets to the hospital, and because you didn't have money, the woman did not even attend antenatal care in a good hospital. So maybe he was attending antenatal care in some backyard mushroom clinic, and they didn't even do what they call pelvic assessment. They didn't even know whether this patient was going to be able to deliver normally. And then all of a sudden the woman falls into labor, and then the husband takes the woman to the hospital expecting to hear the good news, and then the next thing they tell him, your wife has been in labor for 12 hours now. It is going to 15 hours. In fact, even the baby is not breathing very well inside, so there is a need for us to do cesarean section. What will happen? The first thing you hear is the woman will burst into tears. She will begin to cry. The husband will run away. Some husbands will go to the toilet 5 times before they come back, and they will say, hey baby, hey, what are we going to do? That is the tears that is associated with health services. When you have to pay out of pocket, they will tell them, go and deposit 100,000 before we can do cesarean section. That is where the problem. But with OIS, all you need to do is carry your card. Once you carry your OIS card, you get to the hospital, They say, yes, your wife is going to deliver by cesarean section. You say, oh, very well, doctor, go ahead and do it. The maximum you are going to pay may be just 8,000 or 9,000 naira. For something that would have cost you 150, 180,000 naira, depending on the number of CS that the patient has had in the past. That is the beauty of our agency. Our scheme has the slogan, we provide quality health care to the good people of this state without tears. It is quality because once you carry our card, the issue of don't go for antenatal is not, doesn't arise, because once you have our card, in fact, you will go to antenatal clinic very relaxed, because you know that everything you are going to come back with will be only 10% of the cost of drugs. And when you go for antenatal, please, they give you drug worth 1,000 naira. They tell you to go and pay 100 naira. That is all. And you do ultrasound, you have 2 ultrasound free of charge. You don't need to pay a kobo when you are registered with us as OEs. I'm just giving you an example to demonstrate the veracity of our slogan, providing access to quality healthcare without tears. Once you have your card, you are confident. Anytime anything comes, you just take your card to the hospital, a hospital of your choice. The hospital that you have chosen out of accredited hospital. That's the quality. It is not just any hospital. We accredit the hospitals. We go there. We do inspection of those hospitals. We know whether they have enough facilities in terms of equipment to do many of the things that needs to be done. We inspect their space. We inspect the emptiness of the environment. We want to even know the access road. Do they have a good, access road to that particular hospital? And then how many staff do they have? Do they have the medicines that's contained in our essential medicine list? That's the quality aspect of our work. So before we accredit any facility as good to provide service, we will have looked at all of those things, and then we approve that you can provide service. That's the quality aspect. Then the protection from financial tears, from embarrassment, is what I've just explained to you. You are not afraid of the cost, because once they say it, at the end of the day, you know that all you are going to pay is 10% of the cost of drugs. That is all, and that is quite awesome. And the people of Osun State, through the largesse of the governor, the goodwill of Mr. Governor, I keep saying this because Mr. Governor has been a backbone of this agency. He had never reneged in doing all that needs to be done to ensure that the good people of this state get service under this. And everyone that has benefited from this scheme can testify, whether they are civil servants or Yaloja or Kada people.
In the year 2021, as part of efforts in actualizing his vision of being a world-class provider of access to sustainable, qualitative health care, readily available and affordable to the people of Osun State, Osun Health Insurance Agency quarterly held annual operational planning and review of the activities of the agency.
Our vision at OSHA is to be a world-class provider of access to quality healthcare for all residents of the state. Now, being a world-class, provider of access, or a world-class institution or organization, is not something that we just say by words of the mouth. At OIS, we like to walk the talk. We don't just talk and talk. We walk along with what we say. And one of the things that we have done in order to ensure that we are meeting international standards is to ensure that our processes were ISO compliant. That was the first thing we did when we were developing the processes of the operations of OSHA. We engaged quality management systems consultant. We got all the requirements for certification, by the International Standards Organization. And then we, developed our process manuals in line with those, requirements.
This is supposed to be a guide for whatever we are going to do. And so we will not even be ambushed by any difficulty. The beginning of this problem, why people are really not interested in anything insurance, is because there is one thing they say: insurance is a scam. And when they come, they want to take away your money and don't pay you when it's time. But fortunately, with the kind of technical staff that actually started the agency in Osun. We have all opportunity to have a good result.
Also in the year 2021, Osun Health Insurance Agency organized series of trainings for its workers and the stakeholders at regular intervals to enhance their optimal performance. At one of such training, the agency presented ICT infrastructural support and health management information tools to accredited healthcare providers in the state, since the well-being of the people of Osun State is paramount to Governor Adegboyega Oyesola, who is in full support of Osun Health Insurance Agency in achieving its aim of providing every resident in the state access to quality healthcare services without tears.
ICT has become a part and parcel of our system and the most efficient means of doing things these days. Without ICT, we are not likely to get anywhere fast. And that is where we must introduce it to let us imbibe the efficiency that is required in health facilities all over the place. And also that the paradigm of our health issues is shifting from total free health to health insurance. It is very, very important to do documentation. And anything worth doing at all, they say is worth doing well.
Those who do not even have any dream of having capacity to go to the hospital to take care because they don't have a functional hospital in their domain, neither do they have money to access care even when the hospital is there. We enroll them into the priority population program of the state health insurance scheme, and we empower them to primary health centers that are close to them on the basis of 1 PHC per ward, and they access care without having to pay 1 kobo. And the care that they access will go to the second objective of establishing health insurance scheme. That is to improve quality of service delivery. Now this has been the biggest problem that we have had. The biggest problem that we have had. When we were doing the free services program, you can come to the hospital and right from the gate, you will have to buy your exercise book. It is your exercise book that we are going to use to give you laboratory form. It is your exercise book that we are going to use your prescription sheet. It is the exercise book that we are going to use as your case notes. It is your exercise that we will use as your patient notes. Everything in exercise book. That is not how to keep medical records. But when there is economic downturn in the nation, of course government will have to make do with whatever is available. But in line with the current trend globally in the health sector, the goal of achieving universal health coverage demands that a new strategy must evolve to ensure successful implementation of the health services in such a way as to achieve universal health coverage. And that is what gave birth to social health insurance scheme as a strategy towards achieving universal health coverage.
The governor of Osun State, I want to present this working through to State Specialist Hospital at Sujaro. behalf of the Governor of Osun State, I hereby present these ICT tools, monitor, printer, UPS to State Hospital Prefect. I hereby present these ICT tools to State Hospital The ICT tools procured by OEs is to help our services, is to encourage us to transmit from manual to automation. And so they should be coming gradually into automating our services.
More so in the year 2021, Osun Health Insurance Agency embarked on the enrollment of the vulnerable people across the public health centers in these local government areas of the state, where the people trooped out en masse to benefit from the free healthcare components of Osun Health Insurance Agency.
We really appreciate what they have done. This week we appreciate, everybody appreciates the effort for this program. We appreciate them.
Thank you, Governor, for introducing this type of program. We really appreciate it. We've done for you, I wish you the best of luck.
I only thank for God for this program, and God will help them in all everything.
The government I have to appreciate when insurance came, then the state government of Osun State, they are all appreciated.
It's a good thing, not only for the civil servants, but everybody to enjoy.
We thank Dr. Oyesola and we pray that God will give him the opportunity to continue the program.
We thank our amiable governor for giving us this opportunity.
It's very nice, it's very good because there are many people in the community. They can't afford to pay your hospital bill.
Adúgbòlówó gómìnà ìpínlẹ̀ Ọ̀ṣun fún àti àwọn ìgbìmọ̀ tí wọ́n jọ tó ṣe pa ètò yìí.
A sì dúpẹ́ fọ́lọ́run pé àwọn èèyàn jáde gan púpọ̀ ojúlé sójú náà ni àwọn èèyàn ti jáde wá fún ètò yìí fọ́lọ́run bá kún ìjọba ní ọwọ́.
Adúgbòlówó Ọlọ́run fún gbogbo ìgbésẹ̀ tí àwọn gọ́ọ̀mẹ̀ntì gbé nìsín kọ́gbọ́n àwọn tí ò lọ́wọ́ wọn rí tó wà lẹ́gbẹ̀ẹ́ tó pé káwọn fẹ́ lọ nǹkan tó wá sí bíbà wọn á gbogbo ọ̀fẹ́ àwọn aláwọ̀ boyún wọ́n rí ìwòsàn ọ̀fẹ́ gbà.
The program is very good and very interesting even for the less privileged in the Osun State.
And this program is being organized for the vulnerable people. And these people on ground that are enrolled, they are vulnerable people. And through this program, all of them will be benefited. So it's a good program.
That same year, 2021, Osun Health Insurance Agency embarked on the sensitization exercise across every nook and cranny of the state to create awareness on the need to register with Osun Health Insurance Agency to benefit from the GSC packages of the agency, which include eye care, dental care, mental health, pediatrics, orthopedics, minor surgeries, cesarean birth, diabetes management, hypertension, and many more. In the year 2021, being a leading state health insurance agency among the committee of states in the federation, members of board of Borno Health Insurance Agency were led by the Executive Secretary, Board of Directors of Borno Health Insurance Agency, Dr. Salid Abba, to Osun State to acquire knowledge from Osun Health Insurance Agency to improve the health sector of their state. The Executive Secretary, Board of Directors of Osun Health Insurance Agency, who is also the chairman Forum of Executive Secretaries, State Health Insurance Agency in Nigeria, Dr. Samuel Adeniyi resolved that the interactions should be done at the departmental level for the visiting team to achieve their aim maximally, since Osun Health Insurance Agency is blessed with the leaders who are endowed with the spirit of excellence.
Tertiary institutions, health insurance, social health insurance program, which in many states is actually not functioning. In many states, I think this is the first state that I can see that they have gone a bit far as far as tertiary, because even NHIS run away actually from tertiary, from tissue. They run away. Then they cannot do this thing, and then they run away. It's only that they cannot tell us that they run away, but we know that they run away from tissue. So for a state actually to come up and then take over the tissue is very important. And what that means is that it is not only about taking ownership of the tissue. No, it's taking over of the most important population of the society, because this is the youthful population. So taking over tissue adds a lot of value to our healthcare. Not only, we are always talking about maternal and child health, but tissue is as important as maternal and child health. It's an important, because that is the productive population.
In the year 2021, also, Osun Health Insurance Agency embarked on the quality inspection tour to all the accredited hospitals across the local government areas of the state. Meanwhile, before embarking on the quality inspection tour, members of staff of the agency and the stakeholders were adequately equipped for the task with the quality inspection training, where they were taught quality management systems and its principles.
Quality service that we are giving to our LDs to go around and then ensure that things are done the right way. Of course, for all of these providers, we have an agreement that we both signed and that they must comply with. And that is one of the reasons why we feel it is important for us to come and sensitize them on the need for them to adhere strictly to the provision of the service level agreement, and also to ensure that good quality service is given to our LDs.
Before the accreditation, before any hospital, either public or private, is accredited, we need to go around and we have a checklist, and that is a baseline. Baseline in the sense that our thinking is that there's supposed to be an improvement, maybe after 3 to 6 months. For instance, in terms of personnel, let's say we have a doctor before, maybe 2 nurses, but after 3 to 6 months, we expect such an hospital to have an improvement in terms of personnel.
Thursday, December 2, 2021, an history was made in Netherlands with the triumphant entrance of the governor of Osun State, Adegboyega Oyetola, to the ancient town to officially present beneficiary card of Osun Health Insurance Scheme to vulnerable people in the state under the Basic Healthcare Provision Fund and the State Equity Fund program. People trooped out en masse to give rousing welcome to Governor Adegboyega Oyetola in appreciation of his kind-heartedness with his total commitment to the well-being of the entire citizenry, as a qualitative healthcare service being provided by Osun Health Insurance Agency is part of the fulfillment of the promises made by him to the people of the state in the year 2018, while seeking for their mandate to govern the state.
I would like to thank the leadership of OAIS for the standing performance of OAIS since the agency commenced operation. Recall that the law establishing this agency was earlier passed into law in November 2018 to provide affordable and quality healthcare services to the residents of the state without houses.
àti dákúndọ́ lọ́dọ̀ náà pé ìjọba tiwa ìlú wà ń bẹ̀. gómìnà mo kí yín mo fi ọlọ́run ọba tó láyé tọ̀rọ̀ mo fi kí yín wọ́n tẹnu mọ́ pé kó tó di pẹ́ di gómìnà aláǹfààní láti máa jọ pàdé pàpàdé lọ ní mọ́tà tó mọ̀ pé èèyàn jẹ́jẹ́ lọ́lọ́run dání ẹni tó níbẹ̀rù lọ́lọ́run dání.
To crown it all, Tuesday, December 21, 2021, Osun Elders Agency Christian Fellowship joined Christians across the globe to celebrate the glorious birth of the Lord Jesus Christ. The Christmas Carol, organized by the Christian Fellowship of the agency, was its maiden edition. I wish you and I prosperous New Year. Join me next Sunday, God willing, for another educative edition of the program. Till then, stay blessed.